I'm going to invite Dr. Winston to say what, from his standpoint, what the issues are in relation to the public health situation.
Thanks, Mark. So as a nation, we're faced with what's a very traumatic situation, both by experience within Jamaica and vicariously by watching our televisions and seeing what's happening in the United States, in Italy, in Spain, and of course, not so long ago in China, which is still there to some extent. So it's very clear to me that in spite of our activities focused around identification of cases, monitoring, and supplies, we must now turn to, should have already, but it's not too late, to start making preparations for that heavy psychological component. We are already faced with acute stress disorders in persons. I work at the University Hospital of the West Indies, and I'm part of that wellness team, specifically put together throughout this COVID virus time. I've had a number of calls from colleagues who are in the system feeling stressed. It's going to happen on a wider level to the nation. Our mental health system is not the most robust. Now is the time to reach out to persons who can help. We have a psychiatric association, we have psychological associations, and various kinds of associations with different forms of therapists. Now is the time for the government to call all who can provide some assistance to do so. The need will be there. In addition to the acute setting, post-traumatic stress disorder is for sure going to be present. A large number of our persons are going to be presenting with depression. Now is the time to make preparations for addressing those issues. And so really it's putting a plug for the psychological component, which I do not think, I certainly haven't heard mentioned in this setting. There's need for hotlines specifically there for psychological support to ensure that with the agencies appointed out, the associations, we have persons who can volunteer to man those phones in order to assist those in need, old or young, and it could be me as well. Another point I'd love to make is the need to now make preparations for making the facilities, albeit not sufficient, and the reality is we'll never have sufficient beds for the numbers who will be needing this. If it's happened in the United States of America, it's happened in Italy, it's happening in Spain, why would we be different? And so with that in mind, it's really a novel idea to be finding an alternative space to take persons to having recovered from the most severe setting of their illness, to continue their further recovery until they are negative in terms of testing for the virus. I do not know that a hotel or any hotel room is the appropriate place for such a facility. Just think about the logistics, the monitoring of these persons who would already have been in isolation on a ward at the University Hospital, for example, or anywhere else, to continue further isolation. How will you be monitoring that? One. Two, the kind of staffing that would be required. And I'm speaking with a background of training in field hospital management, field hospital erection. I think now is the time to ensure that we identify appropriate spaces to be retrofitted for the erection of this kind of field hospital to move persons, making available the badly needed hospital bed spaces. It's very clear to me that areas like the National Arena, the National Stadium, our National Conference Center are appropriately poised with some retrofitting to do this kind of job. I also know the kind of people who are able to execute this. One group of persons I know, I happen to have a history with them, and that's the Jamaica Defense Force. It is time in such a crisis to ensure that we have command and control of the situation by the JDF. I see no other way in ensuring that this crisis gets the attention that it needs. It's very important. Another very important point, and I've been certainly saying that it is only healthcare professionals or those dealing with persons who are at high risk needing to wear masks. I've changed my position. I've been following, like you, the media, the happenings in different countries, Spain, Italy, the Czech Republic. I have friends in these places who have indicated. They are very clear, they have been for some time. I am now clear as of last evening, and in fact have my own mask, which I'm now recommending that all persons, where possible, all persons wear masks. It doesn't matter the kind of mask. I'm not talking about N95 or surgical masks. It's any mask that can offer protection of any form of droplet coming onto you, or especially if you are ill, you're coughing and leading to these droplets. We're now talking about micro droplets staying in the air for up to 6-8 hours. That's serious, and that can be prevented. At this time, any form of prevention that can be had, and if masks will do even an iota of that, then we must ensure that we're executing what will help. I think that's it for my points for now.